Dear friend, if you find yourself in bed with COVID-19 symptoms such as high fever, shortage of breath, nausea, extreme weakness, and later dry cough, then this message is for you. I'm sharing this message of COVID-19 survivor who experienced all these stages of the disease heavily and firsthand at home. This helped them to discover and test the best attitude to adopt, as well as breathing techniques that may be helpful to someone going through the same unfortunate journey. This disease may make you feel like a weak and helpless victim, with even the breath taken away from you. But these simple breathing exercises will hopefully help you transform your attitude to a fighter warrior, in charge of your own destiny and simply your own breath. A. When you feel shortage of breath, apply blow the pain away technique. If you suddenly discover not being able to inhale as much as you used to and would like to, the feeling may seem overwhelming. You may even start panicking, especially if you are home alone, if it happens at night, and if you experience other symptoms such as high fever, nausea, body weakness, and aches. Natural body reaction will make you gasp for air greedily, trying to inhale as much air as possible. However, this will only make it worse. Opting for more humble and generous attitude, applying slightly modified blow the pain away technique will bring you relaxation and reduce suffering immensely. How to use this technique? Situate yourself in bed in a half-sitting position, resting your back on a big pillow. This position allows your chest to open and free up air passages in the lungs. Open the window wide to feel the abundance of fresh air in the room. If you are feverish, stick only your legs and arms out to cool your body down and relax. Then take passive and shallow breath in through the nose, followed by a long, slow, controlled breath out through the mouth. This type of breathing will take you to a relaxed state of mind immediately. If you adopt this breathing technique for long enough, you will start noticing that you are able to take deeper and longer breaths in, and that the illusion of shortage of breath is gradually dissipating. This breathing sounds like that. The same technique may be very helpful and highly comforting when the dry cough kicks in. Dry coughing may feel excruciating, especially when it turns into spasmodic. Whenever you feel that this coughing is about to start, cough a little, and when you feel you can interrupt it with blow the pain away breathing, do it. To illustrate the sensation of this breathing technique, remember your childhood, sitting on your mom's lap with bee stung finger in front of her mouth, and your mom trying to gently blow the pain away, exhaling slowly through her mouth and as long as she can bear, and thus effectively reducing pain in the finger. Imagine you are your own mom now, blowing the stream of air out of your lungs for as long as possible in a gentle, calming way. This is a perfect example of the sensation and benefits this breathing technique will bring you. B. When you have dull chest pain that induces squeezing, tightness, or pressure sensations in you, apply Bellows, or in other words, fire starter breathing technique to warm and free up your air passages. How to use this technique? Seal your mouth gently. Breathe in and out through the nose with bellows breathing, allowing inhale and exhale to be forceful and to take equal amounts of time. Put your hands on your chest and imagine that your breathing ignites a powerful bonfire within. It sounds like that. This simple but powerful exercise will also help you to awaken the fighter within, freeing yourself from the feeling of helplessness that shortness of breath and weakness of your body may bring. And C. When you feel weak in the body and mind, use blow the candle out technique or skull shining breath. This technique aids to reduce general weakness by clearing mucus in the air passages, relieving pulmonary congestion, and improving lung capacity. How to use this technique? Inhale briefly through both nostrils, then sharply exhale, again out of your nose, while pulling your navel in toward your spine. The exhalation is short and quick, but very active, while the inhalation is short and passive. It sounds like this. To illustrate the sensation of this breathing technique, imagine yourself trying to blow a candle flame out by shooting the streams of air out of your nose. And finally, remember, make sure you also follow the advice offered by healthcare professionals. High fever reducers, blood thinners, and chesty cough medicine are all of great help. Listen to your body and use proposed breathing as a supplementary self-help technique in times of need during the course of this disease. First, use them laying in your bed, later on, while sitting. Never force or restrict your breath. If you feel discomfort or lightheadedness, stop immediately and return to normal breathing. Do the best that you can. The more you practice, the longer you'll be able to perform the exercises, and eventually you'll be able to use more and more of your lung capacity until you are healthy again. May you feel more alive and conscious after the journey through the stages of COVID-19.